Hello, everyone. Thank you for joining our webinar today. I'm going to wait just a couple more seconds while people come online, and then we'll get started. All right. Again, thank you for joining our webinar today, How Forms on Demand Relieves Paper Overload. A couple of quick housekeeping items before we get started. This webinar will be recorded and distributed via email to everyone who registered. All participants will be muted to minimize disruptions during the presentation, but please join in on the conversation using the GoToWebinar questions. We'll have a Q&A section at the end, but feel free to submit your questions throughout the discussion and even chime in if you have an additional thought to add. So let's meet your presenters. I'm Dessiree Paoli. I'm the Director of Product Marketing at Interlace Health, where I'm responsible for helping our customers solve some of their common workflow challenges related to paper and forms processing. I'm joined today by Leovee Reyes. She's the Applications Analyst, Information and Communications Technology at Halton Healthcare, and we're going to go into a little bit more about what she does there in a couple of slides. So thanks for joining me, Leovee.
Thank you.
Before we get started, I want to kick off a quick poll to see how many of you out there use digital forms or eSignature today in your organization. So you should see a poll up on the screen, and you can just quickly click yes or no. And I will wait for a good percentage of the audience to respond, and then we'll move on. All right, we're at about half. So if you haven't done so yet, please just take a second to click on the screen there. All right, looks like a pretty good percentage of you do use either digital forms or eSignature today. So I'm sure many of you will be able to relate to some of the things that Leovee and I are talking about. Thanks for taking the time to do that. I'm going to close out that poll and we will move forward. All right, so I'm going to let Leovee take a minute and tell us a little bit about who Halton Healthcare is.
Thanks, Dessiree. Hi, everyone. Thanks for joining us this afternoon. So I'm just going to talk about our organization, Halton Healthcare, and I'm also going to talk about how Interlace has helped us. Halton Healthcare, we are an award-winning healthcare organization. We are comprised of 3 community hospitals and provide numerous community-based services. Our hospitals are comprised of Georgetown Hospital, Milton District Hospital, and Oakville Trafalgar Memorial Hospital. These hospitals are very much a part of Halton's rich history, and we have a long-standing tradition of providing quality care to many generations of the families in the area. We serve about 400,000 residents, and the population is very dynamic, and it is continuously growing. So reflecting on the dynamic communities that we serve, we do also take pride in recognizing that our hospitals and community-based services are provided on the treaty land and territory of the Mississaugas of the Credit First Union. Halton Healthcare, we always strive to provide care to and promote the wellness of all people within the lands and territory.
Thank you for sharing that with us. So more specifically, can you talk about what you do there at Halton?
Okay, well, I'm an applications analyst, so I've been here for about 12 years. So I'm going to hit my 13th year this November. I started off I started off on the service desk, and this gave me an understanding of all the different units, all the different workflows, the processes, the many different types of technologies, and also the applications that we use, and just the whole organization itself. So then I took this experience and moved into the application support side of things. And one of the main applications that I do support is Interlace Health. I also support modules and expands. I've facilitated nursing and student Meditech orientations. I've done scripting. I also support another application called eSchedule, which is a staffing and scheduling app. And anything else that's thrown at me.
Yeah, I feel like that's something we can all put in our job descriptions these days.
Exactly.
Well, thank you for telling us a little bit more about your role, and early congratulations on your 13 years.
Oh, thank you.
So thinking back on when you first came and found Interlace Health and we began our partnership, what were you really looking for and what led you to look for a vendor like ourselves?
So some of the main factors that led us to Interlace Health is our pricey in-house print shop. We had a pricey, it was a print shop that was costing us a lot. So the process of that was users would actually would actually put in requests to as a PO to print off all the forms. But what we wanted was, when we had moved to a newer facility, we wanted to go paperless because of all the extra costs. We wanted to get rid of our print shop. We had a lot of paper and label printing issues, not issues, but requests. And this, we wanted to be more environmentally friendly. We wanted to use less paper, and also we were spending a lot of money on purchasing paper. A lot of it also was label printing. We had a lot of label printing as well. And also we did not have a central place for all our forms. So most of the time when these people would request, when these users would request copies, they would request 3,000-4,000 of these forms.
Wow.
Yes, yeah, so you can imagine the amount of time that it took and also the amount of paper that we were wasting and we were spending money on.
Yeah.
And sometimes these forms, since these forms took a lot of time to print off, most of the time they wouldn't even use all of them, or even use them at all, period. Because it took time for forms to be printed, and especially if there was a backlog of requests, forms could be updated at any point. Therefore, all those requests, all those forms that were printed were no longer valid. And some of these request changes come from Ministry of Health, so there was no way that we were going to be using those old forms because of revisions that we needed to do. So those were all thrown out. With these forms labeled, we needed to put patient demographics on these forms rather than handwriting them into each and every single form. So label printing was a big issue as well. I mean, you can imagine all those forms being printed and all those labels that had to go on them. And also, if there was a mistake on these labels, then these labels were no more valid, and we had to print all these labels again and take the time again to actually start putting them on those forms again. So this Interlace Health allowed us to have a central place for all these forms. And with forms being on paper, it could end up anywhere in the hospital. So old versions may be used, and that's what we wanted to prevent.
Yeah. We've had a lot of customers share that same type of story with us about how there were just boxes and boxes of pre-printed forms stored throughout the organization, many times outdated before you could even get through 10% of them. So I'm sure many people on the call can relate to that as well. So I know you talked about this a little bit, but if we just dug into maybe one specific department or the process with maybe one specific form, can you tell us about how that worked with the print shop in general?
So one specific form, so basically face sheets. There's always changes on the face sheets that we required, or sometimes the ministry required, or they need more spacing on some of the allergies, or they wanted a field added on that. Then we have to turn around and reprint all of those. And we actually we use carbon paper as well. So some of those, most of those actually were being sent out to a third party to reprint for special printing requests, and that added extra cost to our print shop, because not only you have you're printing off face sheets on plain papers, but you're also printing it on carbon paper as well.
Sure, that's a lot of printing.
Yes, and it added, I mean, everything added, you know, extra cost for the carbon paper, equipment failing, then you have to get it serviced, and if it fails again, then you have to get it reserviced again. Or we actually would have to purchase a whole new equipment for it if it wasn't possible to be fixed.
Yeah, that is a tedious process. So can you share how you use the digital forms library and just dig into that process and the benefits?
So the digital forms with Interlace Health, it allowed us to build our digital forms library. So now we had a central location for all our forms. There wasn't, it was, instead of going from one location to another or going through boxes of pre-printed forms, it was in one central location. So since it was in one central location, these forms were more accurate. They had the most up-to-date versions available. We removed the risk of having old versions floating around. And also the biggest thing for me was, because I was the one that would be updating these forms, and also my coworker had to build all these forms. It was easier for us because we were only updating it in one application. So that took a lot of time off our hands. With web form imprint, our users took to it very well. It was very user-friendly. It was simple for users to understand. Forms can be organized by site and department, and we were also able to use our own naming conventions, which helped us categorize all our forms. Some are order sets, some are downtime, so that our users were also able to search for forms very easily, which minimized a lot of our calls to the service desk. So that helped out our service desk as well. Patient's instructions were also available in web form imprint. And all these forms, all the order sets, all the downtime forms, patient instructions, it was available to our users on demand. So if they wanted several copies of it, they were able to do that. If they wanted to print it off to a different location, they were able to do that. The one thing that our users did have, really did love, which was a big plus on our side, was they were able to mark the forms as their favorite. So instead of going in, having to search for the forms all the time, they were able to mark them as favorites, and they were able to just expand the favorites and find all the forms that they continuously use every time. So that saved a lot of time on their end searching for these forms. On the form itself, we were actually able to print off patient demographics. These can also be auto-populated as well. So as you can imagine, this saved our users on printing them and having to sticker all the forms, and also save them time in having to put labels on all the forms. But with that, we also had the option to print blank forms whenever you needed them. Some users did use it as a downtime solution, just to keep some forms in hand just in case. But this helped them a lot and saved them a specific amount of time, which they were very happy about.
Yeah, I think the patients are often happy too, because they don't have to keep writing in information on forms. If the
Yeah.
particular facility isn't able to label those demographics, then it falls on the patient to re-enter those again. So it saves everyone more time.
Exactly, and our physicians were happy too, because if they were writing up requisitions, they didn't have to keep writing all that information over and over again. So that helped. That they were happy on that end as well.
Great. So let's walk through the registration process a little bit more. So we know how the digital forms library is set up and how your staff can navigate through it. But now, can we talk more specifically about how you utilize digital forms within the registration scenario?
Okay, our registration packages, we base these off of location. We base them off of location, off of clinics, off of even just specific words, and we were always able to use them as our, we were always able to customize them. So that was a big plus on our end. The packages that we would have to, that we set up, they were automatically printing based off of wherever these users are printing, users are registering. So if we had emerge printing based off of the location of these patients, then these packages would automatically print out onto the emerge printers. So we base them off of prefix as well, because some of our accounts are based off of inpatient accounts, clinic accounts, and this was a big plus for us. So that way it actually helped all our staff in having to put all together all our packages with these users. So instead of having them pre-printed off and labeling them and having to put the labels on them and then bringing them down to wherever these patients are going to, this was what helped them in the end. This was instead of having such a big amount of time and having to prepare all these packages, our users were able to just print them off with the patient demographics, with all the forms that they needed based off of what these patients are coming in for. So that helped us out a lot on that one in the end. So our registration clerks were also very happy with this. And I think I've talked to maybe Patricia about this, and I've also talked about it, I believe, sometime last year, was this registration process actually helped us during COVID. And I keep using this example because it was such a big help to us. So instead of having our registration clerks register patients coming in for COVID tests, we were able to set up testing centers. And these testing centers were actually able to be off of in areas that weren't very populated, or that our registration clerks weren't in. So it really minimized the transfer or exposure that they had to COVID. So with this, and as you can imagine, during that time, everybody is very stressed at that point. So in helping this, we were able to set up our testing centers that patients would go in. Patients, our registration clerks would register these patients via telephone, and then they would register them with all the information that they needed, and the packages would actually print out in the testing center. So this really helped them out, and it eased their stress. And also these forms were actually available during in web form imprint. So if they did need to actually print off extra forms for any reason, they were able to do that themselves. The testing center were able to do that themselves. And within web form imprint, you can choose the printer that you're printing this to. So they were able to choose their printer, have all the forms that they needed on hand, and be able to print off forms that they needed ad hoc and with all the patient information or with blank information that they needed.
Yeah, I'm sure that was really helpful, because I think you'd said before there was need to physically deliver the forms or charts to those testing centers, and now you did not have to do that anymore.
Yes, exactly. Yeah.
Yeah, thank you for sharing that process. I want to pivot now and ask one more poll question to the audience. We've talked a lot about print shop today. and wanted to see if any of you are still using a print shop at your organization. So if you can just take a minute and click yes or no as you see that appear on your screen. We've got about 48% voted, so if you haven't yet, please do so. It's pretty close. It looks like about just under half are using one and just over half are not. So still very vastly different across organizations. Thank you for sharing that information. And Leovee, thank you for sharing all the information about the process at your organization. So I want to dig in a little bit more about how we may be able to help you for those of you who are still using a print shop, or perhaps you have partially digitized forms and you're looking to see how you can continue to reduce paper. I wanted to talk a little bit about how we might be able to help you. So like we've talked about today, if you're still printing, there are definitely ways that we can make that more organized and better, starting with that digital forms library, which I'll talk a little bit more about on the next slide, that everyone can access from any location, and you know that only the most up-to-date forms are in there, so nobody will be printing off or utilizing old outdated forms that they're finding in boxes somewhere. And then you've got all that extra storage space as well because you're not having to pre-print those. Minimal prep time because you're just printing on demand and it's automatically pulling through any patient demographics. And like Leovee talked about, you're not having to label or do any of those other process steps in order to get those forms in your patient's hand. And then you just have a standardized workflow. So if you have multiple locations and they're currently doing things a little bit differently, where they're storing the forms, where they're going after they've been collected, this process of having the digital forms library really helps you streamline that across all of your locations to ensure that everyone is printing and collecting the forms in the same way, and most importantly, archiving them or saving them afterwards in the same way as well. So it makes it easier for your compliance team and HIM departments to pop into any location and know where to find those completed forms. So our Forms on Demand solution really offers your staff a simple and, like I said, streamlined way to access and print forms on demand from a browser anywhere in the organization. So whether you need to find those forms for registration, clinical, or even down in a downtime, like Leovee talked about, our Forms on Demand solution provides that access to the digital library for those approved forms and reduces labor associated with finding and labeling, and then eliminates that cost of printing and also shredding all of those outdated forms. So it's clear that forms are so much more than a necessary business expense. They're really essential for collecting and sharing data effectively. And that data on those forms drives the clinical and operational processes that are at the foundation of every organization. So we've heard from many customers that an effective forms technology is a long-term investment in improved data management that ties directly to so many strategic objectives, such as operational efficiencies, patient engagement, patient safety, analytics, and compliance. So Interlace Health is really here to help you with any of those needs that you have, and even just in understanding whether or not there's value in you going digital with your forms, or how we might tap into any existing processes that you have today. You know, like I said, if you're partially printing or you're partially digital, we can help you with that. So I'm going to enter the final poll here and just see if any of you would like to meet with any of us to talk more about our Forms on Demand solution, or even help you do a free ROI assessment to understand how much you could save if you converted to digital forms today. So you can take that back to your leadership and say, you know, here's what the cost might look like, but here is the savings that we would experience, not only from reducing all of that paper, wear and tear on your equipment, but also your staff's time and resources. I was just at the Muse conference this past week with one of our other customers, Brandy from Steward Health, and she had shared that they, in one region, which I think is less than 10 locations, they were able to replace almost 13 full-time staff members just by creating an eSignature registration process and reducing the amount of time it takes to scan in all of that paper. And with staff shortages being so robust across the US and hospitals, that 12.5 FTEs didn't really mean letting go of anybody. It just meant freeing up some much needed time with the staff that they had here today. So looks like everyone has completed that survey, so I thank you for doing that. And we are going to go into questions in just a moment because we've got a few minutes left, but where can you see us next? You can visit our website, interlacehealth.com/contact, if you'd like any more information or a customized demo. Otherwise, we'll actually have a live demo of our Forms on Demand solution on June 1st, and you can also register for that at interlacehealth.com under our resources section. And then our next webinar will be in June 15th, and we're going to be talking about how healthy are the forms processes in your organization and really digging into those costs a little bit more that I talked about as part of our ROI analysis. And then again, like I said, you can reach out anytime for customized ROI analysis or demo, and we are happy to help you with that. Before we open up to questions, just a reminder that there's a quick survey at the end. It'll take you less than a minute. If you can answer those questions, it really helps us make sure that we are providing the best information in our webinars that helps you understand what we do and how we might be able to help you. So I'm going to open that up for questions now. If you have one that you haven't entered yet, please take a moment to do that in the chat section. Otherwise, the first question we have here looks like it's for me, and it is, what EHRs do you integrate with? And so we actually are EHR agnostic. We integrate with any EHR because it's a simple process of pulling the demographics from the patient's chart into our forms, and then you can just quickly print those forms or even just have the patient complete the forms fully digital and e-sign on them, and then they're automatically archived back into the EHR. So we can push those back and pull that data out. And thank you for asking that question. Let's see, next question. Can you print blank forms or do they have to always have those patient demographics on them? That's a great question as well. And I think Leovee talked about this just a little bit, that there is the option there to print a blank form whenever you need it. So for whatever reason, maybe you don't need those specific patient demographics on them, or you're in a bit of a rush and the patient is going back into the room and you need to just send that form with them. That is simple and easy to do. Or maybe you don't even have the demographics in there is another issue, but you can print them on demand whenever you need them and click to have that patient demographics auto-populate, or skip that process and just have those blank forms. And then next one, can these forms be integrated into our existing application, or is this a standalone forms library? So thank you for asking that question. It's a little bit of both, I would say, because it's a standalone web browser based forms library, but we can integrate with your system so that you launch that library directly from your EHR. So it's not an additional step where you have to go somewhere else. You know, with Meditech, you go in and select the patient, and then there's the option to pull up the form. It will launch, you can complete it, and it's a simple, easy process for your staff, so they're not feeling like they're going to 3 different locations. Thank you for asking that question. I'm just scrolling here to see if there are any more questions. There might be one here for Halton Health, for you, Leovee. It says, how long has Halton Healthcare been using Interlace Health? And can you quantify any of the savings that you've experienced?
I believe I'm just trying to go back here. So when we moved to the new facility, we started using them. So that, I believe, around 2014. So we started off with Interlace then.
Okay, so about 8 years.
Yeah, it's been a while.
Yes. Yes, thank you for answering that. I've got another one here that says, where does the data reside, on our hosting site or yours? If you have a chance to put a little bit more information as to what data that you're talking about, please drop that in. Otherwise, I will answer the way I think that you're referencing with the form specifically. So we don't host any of the data. Like we say, we pull it directly from the patient's chart, auto-populate that into the form. The form is then either printed off or signed electronically through our eSignature system, and then pushed right back into the EHR. So we don't save any of your patient's demographics or data in any capacity on our side. We just host the digital forms, but there is an option for all hosting to happen on-prem at your location, or we can help with that as well. And I hope that I have answered the question related to the data that you were referencing, but thanks for that question. Let me see. It looks like I might have answered all of the questions. Let's see. One last question here I missed. Can staff easily access the forms that they use most commonly in the library? And yes, absolutely. And I am thankful that Leovee talked about this a little bit too, is that we have the option for everyone to customize the forms that come up under their own favorites section. So, you know, if you're in the orthopedics department and you only work with 1 or 2 doctors and you're always using the same registration forms or consent forms, you can flag those as your favorite so that you can quickly and easily access them. But it's also set up so that the forms are assigned to the patient based on orders within the EHR. So in many cases, we can make it where you're pulling up that patient and they automatically already have all of those forms assigned to them. But in the case that that didn't happen, you have that favorites option to pull those quickly. I think that about wraps it up for all the questions, and we are at time. So thank you all again for joining today and for your engagement. And thanks so much to Leovee for sharing your story. I really appreciate you and your time. Like I said before, if you have any additional questions, reach out at interlacehealth.com. We'd be happy to chat. Thanks, everyone.